Hey guys, this is Dr. Kyle with Columbia River Chiropractic bringing you your next tip for Tuesday. So we're getting a lot of patients coming in to see us recently that now that the weather's a little better, they're getting out, running around, putting some more mileage on their bodies. And we're seeing some common injuries that are occurring at the ankle and the knee and the hips and the low back. So what I wanted to do today is kind of show you a real common thing that we are finding lately that we can link to kind of that kinetic domino process all the way up the leg and into the low back. So basically what we'll do, I'll show you this model of the foot. We have three main arches in our foot. We have two that go this way, called a medial and a lateral longitudinal arch, and then we have a transverse arch, which basically means it goes this way. The common thing that we're finding in feet that I think is linked with a lot of the stuff further up the leg is associated with this lateral longitudinal arch. And I think this is partially due to, this is the part of the foot that really gets compressed if we ever have a rolled ankle or a sprained ankle. And sometimes what it can do is shift a little bone that sits right here. You can't really see it with this stuff over it, but there's a bone right there called the cuboid bone. And that's actually known as a keystone bone, which essentially means that it's locking everything in our foot in place. So if it's stuck or if it's not lined up how it should be, it can really compromise things further upwind. So with our patient Lisa here today, we're going to use her as an example to show how this bone can actually affect what's going on upwind and have big implications as far as a lot of you runners out there are concerned. So in our clinic, we do a real simple test to see how these bones are doing in the middle of the foot. We'll use her strong leg first. So Lisa, what I want you to do is hold your foot up and in nice and strong. Good. And then I'll have you hold your foot up and out. So up and out, that's the one associated with the cuboid bone. And you guys can probably see from that angle, she's nice and strong with that. But if we go over to this foot, Lisa, hold up and in for me. So she's going strong in, but when I have her go out, hold up and out, you can see there's a weakness there. Hold up and out. So it's just not engaging. And why this is so interesting is this one bone is inhibiting her entire outside of her leg from working properly. And why this is a big deal is this outside of your leg is what keeps your ankle in kind of a neutral position. So if you're running, every step you take with that leg, your foot's kind of dipping in, almost like you're giving yourself a minor sprain of that foot. So what we do to correct that is a very simple adjustment. So Lisa, try and let your leg relax for me. Very nice. So we're going to retest these. Lisa, hold up and in, and then hold up and out. Very nice. Feel different?
Yes.
Okay, good. So this test in particular is probably hard for you guys to see from this angle, but knowing that we can immediately restore the strength in the side of this leg just with a simple adjustment, like I said, can have huge implications as far as some of those repetitive use injuries are concerned associated with running. So if you guys have any further questions with us, or what we did here, please don't hesitate to look us up and see if we can't help with some of your foot issues. Again, I'm Dr. Kyle with Columbia River Chiropractic. Thanks for watching.